Evening, everybody. Welcome to a Monday live stream. Sorry that it's on a different day, but that's because yesterday was Mothering Sunday here in the UK. So I went to visit my mum with my daughter, and obviously my dad was there as well. So we had a lovely day, nice Sunday lunch, and a Chinese for tea. So that's why I'm here on a Monday. But today's subject is going to be on allergies. So please feel free to put all of your questions in the comment section. I'll just wait and see how many people are jumping online. Everything is set up. So, welcome, Kirsten. That's fine if you want to carry on working and listening. And welcome, Amanda, as well. So, yep, lovely to have you both here. So I'm just trying to see if I've got Nightbot on the line. Let's see if Nightbot's working. Still getting used to how everything works with StreamYard and Nightbot. Yeah, Nightbot's working, so that's excellent. Yeah, so I'm just going to start off. There is so many elements to allergies, from severe anaphylaxis, which can happen to food, medication, really many different things in nature that can cause anaphylaxis. And then there's allergies such as hay fever, atopic dermatitis, um, food allergies. So it's a whole range of things. Mast cell activation syndrome, or MCAS, as it's usually called. So there's so many different types of allergies, and it's all when your own body's immune system is finding something that shouldn't be there and trying to deal with it. Like it would an infection, it tries to kill it and get rid of it, and sometimes it just goes into overdrive. Yeah, so allergy to penicillin, that is probably the most common one that people know of in drug-related allergies. And then obviously seasonal allergies. I'm assuming you mean to different pollens, but people who have seasonal allergies to pollens, they're quite often also allergic to things like house dust mite and such like that are there all the year round and can cause similar symptoms. So, then Ah, so do you mean that sensitivities, as in certain smells, cause symptoms of allergies, or is it that certain scents trigger things like migraines? Because there is different things, and yet the allergic enough that there's different levels of allergies depending on which part of the immune system is actually um, activated. So you've got anaphylaxis, which is sort of it breathing and can lead to death in severe situations if you cannot get an EpiPen or adrenaline or to the hospital in time. And obviously that is seen as extremely serious, life-threatening and immediate. But then there is allergies that are just sort of long-term and chronic, either sort of nasal, cough, postnasal drip, sneezing, eyes watering, sort of that's very common with sort of pollen, but can also happen with other triggers. Well, yeah, so you've just listed them all there for me: laundry detergent, pets, grass, dust, mold. Yeah, and obviously sometimes that is related to people that also have asthma, so it fetches out their asthmatic symptoms and can cause an asthma attack where there's bronchospasm and restriction of the breathing, which asthma attacks again can kill people. I've just shared a link in here about sort of why asthma still kills, because asthma still does kill people. Even though there are medications out there that should be able to help people get control of their asthma, not everybody has their asthma treated as effectively as they should be, whether it's um, on the patient's and the sort of perception of this is only a little bit of breathing, it's not that severe if they've never actually had a severe asthma attack yet and don't realise what's going to happen, or even if they've got relatives that brush off and go, "Oh, stop whining, just take your inhaler." There's a lot of media sort of representation of asthma as just very flippant. They quite often they'll just put it as the nerdy person in a series as the nerdy person has asthma and just dismiss it when actually it's a serious medical condition that can still kill people. And then there's medical professionals that don't always take it as seriously as needed and making sure that patients go in for their yearly annual asthma reviews. Sometimes patients can get lost to follow up, especially if they maybe can't afford to get their inhalers and don't realise that there's like a prepayment certificate here in the UK or in other countries where you've actually got to pay for all of your healthcare. They may not feel as though they're able to go and get all of it. But yeah, asthma can be very severe and can be have an allergy component. Along with asthma and allergies, another one that often coincides is eczema. So there's eczema and atopic dermatitis where it's actually affecting your skin. So the same sort of things that could affect breathing in somebody can affect their eczema and trigger it. And it can be something that flares up and down depending on the amount of different things they're exposed to at any one time. So they might be fine. Say they've got one cat, they've just got the cat's fine, they're all right. But then something comes along and then they're also being exposed to the pollen levels are suddenly sky high. They suddenly have a change in laundry detergent and then suddenly that triggers it. And then it's the combination of all three things together that sets it off over the threshold when, one or two things might be able to be coped with. And that's another one which people don't always realise that people with these allergies, they can actually be allergic to stress as well. And stress can be a contributing factor. The raised cortisol levels during stress can actually enhance the allergy syndromes that they've got and make things even worse. And I know that's sort of, I've had family members with that. Their skin suddenly broke out really, really badly due to stress. And so then suddenly when they were able to cope with a certain amount of food that triggered their eczema and they were able to cope with small levels, then suddenly even just having small levels of them food, suddenly they just couldn't even cope with any amount of the allergen exposure because of the stress levels they were currently through. So, hi Lisa. Nice to have you here. And yeah, Kirsten, yeah, the need to feel like living in a bubble. I totally understand. And again, this comes to there's two schools of thought of whether to expose people to allergens or not. And this is a very true for there's been a lot of new research now on whether the rise in allergies is because we've actually protected children from different things during their early childhood and whether we should actually be exposing smaller children to more things earlier so that they don't then have their sudden reaction to different allergens later in life. And the research on that is very interesting. So now they are actually thinking there was advice for many, many years not to give young children any peanuts to try and reduce the risk of kids getting peanut allergy. But then they've actually found that actually maybe it is better introducing peanut earlier. And it might actually then reduce the risk of them having peanut allergy if they get exposure earlier. Also, some theories about whether exposing mothers while they're pregnant to different things, so that the embryo as it's growing is exposed and realizes that there's different things shouldn't that their body realizes, oh, they're natural things that we're going to be exposed to. There was an interesting article I read about oats and what they put on skin of kids with eczema, and they realised that if they put things on kids with eczema that have got very sort of broken skin and permeable skin, if they're putting things on the skin but they're not actually eating them, then actually that triggers to the body that actually that's something external that they shouldn't be taking, and they need to actually eat it as well. So with oats, um, you should be exposing toddlers to eating oats if you're going to actually be using oats on their skin. Otherwise, when you use oats on their skin, it might actually sensitize them to having an oat allergy, which I thought was very interesting, especially seeing as a lot of dermatologists and such like do recommend oats as soothing for eczema in small babies. But if they're only exposed to it on the skin and not internally, then the body can end up getting a reaction to it, which I found very fascinating. But the thing with allergies is each person's body is unique, and what may or may not trigger in one person is different from others. So although we might have these studies that say if that in 1,000 people, generally it will be better to have exposure, there is also some people where that's never actually going to work. So I'm just gonna, make sure you put your questions in the chat. So yeah, and there is that with some allergies. So with some allergies, having exposure, actually there's what's called exposure therapy actually helps reduce the allergy long term. But then there's the opposite way with some people. The more you get exposed, you build up, each time you build up a higher and higher level of allergic reaction to it. So it becomes more and more severe each time. And which way a child is going to go with that, it is, well, there's still a lot of data out there. I was going to suggest there is a few good allergists that I follow on Instagram that I do share. One of them is Ruben Allergy, and he's brilliant at going through different things like this and explaining. I'm going to say here, I'm not an allergist. I don't really have a special interest in allergies other than I do have family members and I have helped treat some patients with allergies. But my main expertise is on the medication around it, not on all the exposure therapy and things. But there is some good evidence coming out there, but it is something you need to talk through with an allergist and your doctor. And I would say if you have got severe allergy and you've got an EpiPen, at no point try exposure therapy on your own without help. I'm assuming cedar trees do exist in England. I know when I used to go out and about, my granny used to point out cedar trees. I don't know whether it's a common allergy here in the UK. I do know we have the pollen charts that you can have a look and see when your hay fever symptoms start and work out which pollens they are. I do know that when my symptoms start, usually at the end of May, it is usually some grass and some rapeseed oil pollen that starts me off, and it's always at the end of May that mine starts. And I'm pretty sure that sort of cedar tree allergies, I'm sure that's one of the earliest ones to start within the year. But there is pollen charts that show which pollens are at different times of the year. But then we have weird weather, like we've had, where you think you're having spring early, and then suddenly you have winter again, and that can throw the plants out, and pollen can be released at different times to what you was expecting and what you've had in previous years. So your brother and sister-in-law tried expose your nephew to 100 foods by a certain time, trying to help. Yeah, unfortunately, that is the problem. And when they've been doing these exposure therapy testing, they have picked children to do these studies in that have family history of allergies, and that is one thing I'm going to mention. Allergies is something where there is a genetic component. So I am waiting for my allergies to get worse as I get older because it has been a pattern previously in my family. Also, I do know that I've got Ehlers-Danlos syndrome, and there is a big crossover of allergy syndromes with Ehlers-Danlos syndrome. So there is genetic components, and then there is a certain amount of environmental um, components. So hi Sam, hi Al. And yeah, so seems to quite a few people that have already mentioned hay fever. So I'll probably start with hay fever. I will be talking about sort of the generic names of the medications that are available in the UK. Now I do know it is different in the US, and so there is different antihistamines available over there and different products. So it's always best if you make sure you read the labels and look at um, what the generic medication is in there, especially with a lot of cough and cold, hay fever products. There's a lot that actually have multiple ingredients in there. So you really have to be careful when you're reading it to find out what's in there. So with hay fever, one of the biggest things that you can do is try and reduce exposure to the pollen. So simple things like even wearing sunglasses can help reduce exposure to the eyes. There is things like actually having just either nasal sprays of saline or nasal dousing to actually wash the nose out of any pollen that's got stuck up there. So that can be quite simple, reducing the pollen. Keeping windows shut during the day so that the pollen isn't coming into the house. Also around the house, you can make sure that when you're hoovering up often and having really good filters in your hoover that are designed to sort of make sure it pulls up all the pollen, house dust mite, stuff like that. When you are dusting the house and cleaning the house using a wet cloth, not a dry cloth, so that it actually all the dust and pollen sticks to the duster as you're cleaning the house, and you're not just spreading it up and into the air. And then there are sort of more fancy things rather than having a fan to keep the house cool, having air purifiers and such like to clean the air in the house. And then obviously minimising time outside during peak pollen. Keep an eye on the weather forecast, which usually has pollen levels as well. There is some debate on whether hay fever systems are better or worse after a thunderstorm or after rain. Some people seem to think that the water pulls some pollen to the ground, but actually sometimes it can actually allow the pollen to release, and some plants actually release the pollen after a good rainstorm. So that doesn't always work. Yeah, it is a bit of a catch-22 with dust allergy. You need to keep your house clean to keep the dust levels low, but as you clean, you are disturbing the dust and raising it into the atmosphere. So the best bit would be to have somebody else clean your house and not be in the house when that happens and allow it to settle. But yeah, that's not something that we're all privileged to have. So, and then yes, oh, hi Lynn, great to have you here. So I've had allergies and asthma that came on hard at age 13. Yeah, my hay fever didn't actually start until I was at university, and I actually think it was the change in pollen as I moved away to university, as well as the stress of moving away to university that triggered my hay fever. Although I'd always had sort of a bit of eczema and such like, and now currently I'm being tested for adult onset asthma, and because I've got my eczema and the hay fever and everything, it's testing me for adult onset asthma. But there again, I also think I might have had the 100-day cough, the whooping cough that set my lungs off. But yeah, allergies can develop in adulthood and even in late adulthood. Like I've had some family members have developed atopic dermatitis really severely um, in their sort of late 40s, 50s. So yeah, and yeah, you say you've had respiratory problems as a young child. So yeah, and there is that some something can happen, an actual virus or such like that damages your lungs and then causes damage later on. Yeah. So asthma does have an allergic component to it, and some of the newer treatments with asthma are also the same biologicals that are being used to treat allergies. But I'll move on to them later after I've gone through all the basic over the counter things. Yeah, some people do say that hardwood floors are better than carpets because carpets can keep the dust in there. So yeah, you're very lucky, Lisa. Oh, bonsai trees. Okay. Um, although there is different things. I know of someone who is extremely allergic to pine trees. That much so that they in December they cannot leave the house um, because everywhere you go, they either put up an actual pine tree, conifer trees, um, in the sort of entrance of a supermarket, entrance of shops, or they even just have pine smell um, floating around in the shop to make it smell Christmassy, and that's even enough to set off their anaphylaxis. So, I'm going to move on from sort of the practical things. So the avoidance of things that trigger you is always going to be the best unless you have been told by a consultant to keep exposure to prevent the allergy getting worse. So most of the time it's avoiding sort of what allergen, but that isn't always possible, like, especially when you've got multiple things that you're allergic to. So you're trying to keep it as a minimum. So one of the mainstays for sort of general allergies when it comes to um, sort of especially sort of rashes, hay fever type symptoms and such like is your antihistamines. Now these come in two types. Your drowsy antihistamines, which in the UK is chlorpheniramine, but I know in the US you still have the Benadryl as the drowsy antihistamine. And that one can be good, especially for children and for skin allergies, but not so much for hay fever symptoms or for adults. Um, for hay fever symptoms and for adults, it seems to be the non-drowsy once a day antihistamines that seem to work better, which in the UK is cetirizine and loratadine. Zyrtec is the brand, and I think that's the same brand over in America as well. And they're just a once a day tablet. There's the standard over the counter dose of 10 milligrams once a day. In children, interestingly, the dosage is 5 milligrams twice a day. So it's half the dose, but you need to actually take it twice as often because although children are smaller and only need half the dose, their livers actually metabolize it much quicker so that it runs out their system quicker. And so they need to have it twice a day at the 5 milligram dose. So under 12, from 2 to 12 for cetirizine for children, it is actually 5 milligrams twice a day or half tablet twice a day. Whereas for adults, it's 10 milligrams once a day. Very occasionally, doctors will go above them doses, but that has to be under the advice of a consultant. to know that you can take the higher doses, but that there is room for movement, which shows that at the over-the-counter doses of just one tablet once a day is perfectly safe. Hardly anybody has side effects to the antihistamines, although rarely people can be allergic to antihistamines. People can be allergic to anything, unfortunately. And although the once daily antihistamines generally are non-drowsy, there is a subset of the population that will still become drowsy from the non-drowsy antihistamines. And if you were to take them in higher doses, it would pass into the brain enough to cause drowsiness at the higher doses. There is another antihistamine, which for a long time was kept as prescription only, and that was fexofenadine. And for a long time, people always thought that fexofenadine, because it was prescription only, was stronger. But actually, when you look at the trials for fexofenadine, fexofenadine isn't actually any stronger. And if you do a head-to-head trial, cetirizine does tend to work for the majority of people better than fexofenadine. That's not to say that some people may find fexofenadine as an individual better. The reason why fexofenadine was kept on prescription for such a long time is because for certain individuals who have got heart issues, you do need to be aware that it can cause heart arrhythmias in people that are at high risk. And so that's why it was always kept on prescription for so long. So if you do actually buy fexofenadine over the counter, it is the lower strength of it, and there is warnings on there that if you have any issues with your heart, that you shouldn't take it over the counter. You should go to your doctor and take that. So, right, I think I've missed a few comments, so I'm going to go back. Asthma is triggered by black mold. Yeah. The problem with black mold is, as well as it triggering asthma, triggering allergies, it can itself cause infections and problems, and yeah, can lead to chest infections, which obviously if you're having a chest infection to a mold, it's not a bacteria, so antibiotics aren't going to work. And really, any houses that have got black mold, they really need treating correctly. And then if the landlord isn't, then they need reporting, because black mold needs treating properly and eradicating, because it can be so damaging to people's health, especially people who have already got a low immune system. Atopic eczema, yeah. So an atopic eczema is an indication if babies and toddlers have atopic eczema, they're more likely to then end up with asthma. They're more likely to end up with other allergies later on in life. I'm glad that a lot of people can grow out of it, especially asthma, as their lungs get to full capacity, can grow out of it, and eczema can lead. But they may always have certain sensitivities, especially if they go through a time of stress. Times of puberty is always a time of change, and they may find that there is certain things that they're allergic to in the future. So it's always worth keeping an eye on and being sensible. Yeah. So unfortunately, looks like you've also got the pine allergy, and yeah, the pine scent they use. And I think that's something that people need to realise, that it's all the rage to have candles, diffusers, air fresheners, and such like, and they can cause allergies for so many people. Putting that aerosol of something into the atmosphere, if you can smell it, you can have a reaction to it, because if you can smell it, it's hitting the receptors in your nose. Therefore, if it's hitting the receptors in your nose, you can have an allergic reaction to it. Um, so yeah, people do need to be very aware of that sort of thing. And I do think there needs to be more sort of risk assessments done of when people think, oh, it's great, we'll just make this place smell so nice. I have a problem, doesn't set off my allergies to me, but it does set off migraines, certain scents. It set off migraines, which I've done a previous live stream about migraines if anybody's interested and didn't see that. Oh, yeah. Well, yeah, this is one thing that does get me. So YL is Young Living for anybody that doesn't know. They're a multi-level marketing company that sells essential oils. There's also doTERRA, another multi-level marketing company that sells essential oils, but not just as MLM companies. Essential oils generally being sold. A lot of people sort of say, "Oh, but they're natural. Um, they'll be healing." The fact is, when it comes to allergies, the things that people are allergic to, for the majority of the time, are natural products. The things that cause an immune response quite often are proteins and things that nature has created. So when you think of some of the major allergies, it's peanuts. It's a protein in peanut. For celiac disease, it's the protein in wheat. It is proteins and natural products that actually cause allergies and actually cause the danger. So people saying that things are natural are therefore safe is actually wrong. Things that are natural are probably more likely to cause a reaction than something that's totally synthetic and it's just neutral to your body. Your body doesn't care about it. It's neutral. So that's always a big fallacy when these companies try saying, "Oh, we're so safe because we're natural." When it comes to allergies, that is so not true. And then again, I don't like the MLM company side of it where they're using their advertisers are people that are not even paid unless they actually manage to sell something. So it's not a very good business model. So sometimes the older allergy, not drowsy medication can be better, especially for people that have got skin itching and such like, because it helps reduce your sort of reaction to itch, your sort of your I can't remember what you call it. You just you sort of reflex to itch because you've got drowsy and sleepy. That reduces that reflex to scratch, because scratching is always going to cause more damage. That's where you're likely to put break skin surface, allow bacteria and such like to get in the skin, and eczema can get really badly infected. Hi, Mr. Ranger Lab. Yeah, so I understand if you can't, if you're on the road, you won't be able to type. So, right. So, yeah. So, antihistamines can have a very slight, what they call anticholinergic burden, which is it can sort of pass into the brain and slightly depress the nervous system. However, the long-term risks of dementia are very low. There is a lot of other drugs out there that are probably more likely to have the long-term effect of dementia than as antihistamines. But yeah, you've got to work out risk versus balance. Yeah, you've got to understand what is your likely risk of dementia anyway. Um, are you at high risk of dementia from family history, or is that very low? Because if that's already very low, increasing it slightly might not actually be of bother to you. Also depends on how long you've got to go until you reach the age of dementia. Are you planning on getting there? Um, because as you said, you might be more interested in living now and having good quality of life now and worrying about that later. So I was going to say, if you're not going to be worrying about dementia for another 30, 40 years, we might have found treatments for dementia in 30, 40 years. That means that actually that's no longer an issue. So it's always a risk benefits. Yes, all medication come with risks, but they also come with benefits. And if the benefits are up here and the risks are only down here, then that's a risk benefit discussion. So I would say go back, have another discussion with your doctors and say if they're not going to allow you to have Benadryl, what other things are they going to do to treat your allergies currently? And if you're not getting that decent risk benefit discussion with them, actually having a good, um, you know, understanding and discussion, then look at getting a different healthcare professional or a different doctor that can look at your whole package. Oh, yeah. So when it comes to taking a quarter of a pill, this can be difficult to unless they're scored in half and into quarters. It can be very difficult, or you need to get a actual pill cutter. You can actually get little devices that have got a little metal knife in it where you can put the pill in and actually chop it in half and then chop it in quarter. But then, and then trying to find some way of swallowing it. Quite often, if that is the thing, you could always pop it in a spoonful of yogurt or such like, as long as I was going to say Fenagan's fine with that. It doesn't interact with whether you're eating or not. Obviously, with certain medications, you can't mix with food and such like, so you do need to double check that. But a lot of times, if you swallow it, struggling to swallow it because it's sort of sticking or whatever, following it with a spoonful of yogurt or such like to fetch it down. Right. Yeah. So I've talked about fexofenadine, Montelukast, and there is I can't remember the name. There is another Lucast. These are anti-allergy medications specifically for asthma. So these are for asthma when there is an allergic component, and they seem to work best for children. They don't work as effectively in adults, but some adults do get benefit from it, especially adults who have also allergies to aspirin or have nasal polyps. It seems to work specifically well in those. So Montelukast can be a good addition as an anti-allergen for people with asthma. There has been a warning on Montelukast that a very, very small amount of people can have some psychiatric side effects from it, but the warnings are usually put. And if you haven't had it within the first few weeks of taking it, then you're usually fine for it to be continued long term. Hello to my mum and dad. Okay, so I don't like blue cheese, but I'm not allergic to it. But that is one interesting thing that I have learned recently. So people quite often think that they're allergic to blue cheese because they think they're allergic to penicillin. So yes, some blue cheeses do use a penicillin mold in them to create the blue streaks. However, it is a different penicillin species to the penicillin that's used for creating penicillin medication. So if you have an allergy to the blue cheese penicillin, you don't necessarily have an allergy to the penicillin in medication, although some people do. But they are two different things. So just because you're allergic to one doesn't mean you're going to be allergic to the other. And so it can be worth, in a safe environment, trying the other if you want to. Now, when it comes to pineapple, and a few other fruits, such as kiwi, have what's called a latex and enzyme in them. And quite often, some people that are allergic to pineapple and kiwi are also allergic to latex. If you were to Google latex fruit allergy, you'd get the list of those medications and the latex. So there can be a crossover there as well. So again, if you're allergic to one type of allergen, sometimes you can be allergic to similar things in the same family of the same sort of allergen. Hi, coconut. Yes, like strawberries and tomatoes. I have sort of inferred that allergies are in our family, but yes, strawberries and tomato allergies are in our family. We don't put any strawberries anywhere near my mum, and this is the thing with food allergies. Even so, you may think that you allergic to fruit or a different food, and so you try and avoid it in actual eating it, and so you don't eat it. But you may also need to make sure that you avoid it in your environment as well. And I'm going to share a story. I hope my mum don't mind. Of my mum, knowing that she was allergic to strawberries, it would fetch her out with a whole rash on her body, so she avoided eating strawberries. But all of her friends were going strawberry picking, so she went along and thought, well, she can still enjoy it, she just won't eat any strawberries. However, the picking of the strawberries and touching of the strawberries, even though she didn't eat any, was enough for actually to flare up her skin and for her to be allergic and have that contact allergy on her skin. So, and that's it. And this is where people with severe, very severe peanut allergy, they can avoid eating it, but if they're in a very enclosed space with other people, and I am going to quote aircraft for this, um, and it's actually in the atmosphere. As I said, if you can smell something, you are getting that molecule into your nose, and you can then have that allergy. So, oh, yeah, I can't remember what I've said that's useful, but hopefully. Hi, Natasha. Um, Not as such. So no, your antihistamines, the once daily acting one, although it can take 2 or 3 days for it to build up to be of maximum therapy, so it is always best if you know that hay fever season's coming on, that you actually get the antihistamine in your system earlier rather than later, so that your body is keeping on top of that histamine before your body's produced all the histamine. So don't wait until your actual symptoms are at its worst and then your antihistamine has got a lot of histamine to try and combat. If you start it early, build it up. It takes 3 or 4 days and then it builds at a steady step level. The allergy medicine itself doesn't stop working. It will still be working and it will still be working at the same amount against the histamine. However, your actual allergic response may worsen. Different factors in your life, different amounts that you're being exposed to, may mean that the allergy antihistamine isn't enough. Your allergies have got to a point that they're more severe and they actually, you need to add on another therapy on top. Usually swapping from one antihistamine to another doesn't work because they do work on very, very similar modes of action. So swapping from one to another isn't likely to work unless it just happens that one does work better for you than the other. But yeah, you don't really need to clear them out of your system and start from scratch. It's not something like your opioid medication where you do get tolerance to the pain relief from it and you need to sort of try and cut down and start again. But there is other things that can be used other than antihistamines for treating. So yeah, tiny little pills. Yeah, having small doses can be very different. Okay. I've got a feeling that they're all American names because I don't recognize the brand names of any of those. So I'm assuming you will have a preventer inhaler. The bilastine, I'm assuming that probably might be an antihistamine, but do you know what the generic name is for them? Salbutamol is obviously the preventer inhaler, and I have already done a very good video about why asthma still kills and how making sure you don't overuse your salbutamol inhaler. If you are finding you need to use your salbutamol inhaler more than a few times a week, make sure that you go back, get a review, and get more preventer medication in your system so that you're not actually at the point of needing the salbutamol all the time. Okay, so the pine tree allergy is a lot more common, or I've just seemed to have attracted people that are allergic to pine trees. Oh, you're in Canada. Okay, yeah. That is the problem with being multinational on YouTube. it can be hard enough to remember all the generic names of medication. To then remember all the brand names can be difficult as well. And there is occasions where a brand name can be the same in two countries, but have a different generic drug, which can be extremely confusing. And that also can be within the same, especially when you've got ones where you'll have the brand name, but then they'll have an XL version or something else or a Max, and then it's got different medications in it. So like Lemsip and Lemsip Max have got different medications in there. Yay, excellent. Great to see you here, Nikita. All my live streams are saved on my channel. So if you ever do miss a live stream, you can watch it back on replay, watch it back on double speed if you find it too slow when I'm umming and ahhing. I won't take offense at you doing that. Right. Tested for allergy to nickel and dust, pets, especially cats, pollen. Yeah, so that is one thing I am going to talk about is the different types of allergy testings. So there is what they call IgE allergy testing and IgG allergy testing for different foods, different things for atopic dermatitis and skin allergies. And these are often usually done by the allergist. And when they're done by actually through immunologists and allergists correctly, they will actually go through the results with you and explain what the results are. But we are getting more and more of these companies that are selling allergy testing kits or saying that they can test for allergies. And these aren't necessarily as legitimate or as accurate as they're making them out to be, because allergies do change and allergies are different depending on different sets of circumstances. As I said earlier, stress can be a big trigger on how much you are going to be allergic to different things. And sometimes it can be a combination of 2 or 3 things. If you're exposed to all of them at the same time, then you've got the allergy response. And maybe if you just have one at a time in low doses, you're fine. So some of these allergy testings are not as useful as they try and make out to be. And what can happen, especially with some of these food allergy testing kits that people send off for or do for companies, end up with people thinking that they might be allergic to things or intolerant to things, and then actually stopping having those products and foods, really restricting their diet, and actually then becoming problematic in getting all the nutrients they need. But also because they've avoided those products, they actually can cause problems further along. So it's not just as simple as in if you've done the testing, that is definite for life. Things can change. I've never been able to eat blue cheese. The thought of it and the taste. I have tasted it and I don't like it, but yes, the thought of it also doesn't. But I'm very weird because I can't eat certain types of soft cheeses and certain types of melted cheeses. But I would say that's more of it's an intolerance rather than an allergy, which is one thing I'm probably going to mention. So, as in, if I eat certain types of soft cheeses and certain types of melted cheeses, I think it's to do with the fats in them, and then they make me violently sick afterwards. Although being allergic, as in your body causes an immune response to a drug or to a food, sometimes that can cause vomiting as well. But normally it comes along with lots of other side effects, such as wheezing, breathlessness, skin, and such like. So, yeah, so and then there is a big difference with foods. You've got people that have got food allergies, as in if they eat just the smallest amount of a food, they can either have an anaphylaxis or they could have extreme diarrhea and vomiting, or, they could have a whole host of severe rash all over the body. And it's actually an immune response. Their body's actually attacking whatever the protein is or whatever the food is, and causing that major flare up of the immune system, histamine release, cortisol release across the whole body, to the difference to what we call intolerances, which is where your digestive system or your body just can't tolerate having too much of a food, that it causes bad side effects. So it's not like an anaphylaxis or such, like it's a bad side effect. So the ones that I like to mention with is milk. So cow's milk allergy is an actual allergy to the protein in cow's milk. And when babies have this, they physically cannot keep any milk down, and they any cow's milk down, and they have severe response to that. And they should then avoid all milk at all costs, and cheese quite a while. You've then got what you call your lactose intolerance. Now, this lactose intolerance is your body's inability to break down the sugar molecule into the two component molecules to be able to be absorbed. So when you eat the lactose, it quite often just goes straight through you because your body can't digest it. And that's an intolerance, not an allergy, because your immune system isn't involved. It's your digestion that's involved. So the subtle differences, it's the same when it comes to medication. So you can have an allergy to a medication where you either have an anaphylaxis, you either have a rash all over your body's immune system is attacking that molecule, doesn't like it being in the body, and is attacking that molecule, trying to get rid of it, causing your body to have an extreme reaction. Compare that to a side effect, which is, it might be an effect that the molecule has on your body, but it's not the effect that you wanted. It's not the benefit you wanted. So therefore, it's a side effect. And this comes with antibiotics. So penicillins, you can have an anaphylaxis response to penicillins, rash all over the body, breathing problems, mouth swelling, vasoconstriction onto anaphylaxis. But then the majority of antibiotics will have the side effect of vomiting and diarrhea, because it's killing off your good bacteria in your intestines, and it's irritating your intestine lining. And that's the side effect. So just because you've had that side effect to a medication doesn't mean then you have to avoid all that different type of medication going on in the future. I'm just going to move on a bit further before I mention more about drug side effects, because I think I'm getting far behind in the comments. Okay, that's not looking good, but again, I did say a lot of allergies are genetic. Strawberries. Okay, that's interesting. Although I know with my mum, she can't even eat organic ones. It is the actual strawberries, because she's been strawberry picking when there hasn't been. Codeine, yeah, so as we said, codeine does have a lot of side effects to it, but there again, there are people that are truly allergic to codeine as well. People are allergic to morphine. Yeah, we get more and more. Right, so allergy to penicillin. Now, there has been some work done recently to try and have a look at the amount of people that are allergic to penicillin. So there is some statistics that show sort of 1 in 10 people have documented that they have an allergy to penicillin. However, we are running out of antibiotics, and we've got we're running out of newer ones, and more drugs are becoming resistant to antibiotics, although they are still sensitive to penicillin. So there's some work to look into. Are people truly penicillin allergic? So they're doing some review. A lot of people got mentioned that they're allergic to penicillin, and it's been documented. As I've just mentioned before, they didn't actually have an allergy to penicillin. They had a side effect to penicillin. So they may have had diarrhea with their penicillin. And maybe if they have it again in a different form of penicillin or in a different dose regime, they may be able to have the penicillin. There is also people that had penicillin and they had a rash. So they didn't have the anaphylaxis or breathing issues. They just had a rash. And if this was at a time when they might have also actually had a viral infection, they could have what's been known as it's called the amoxicillin viral rash. And it was actually an interaction between the virus and the penicillin that's caused the rash, and not actually the penicillin allergy causing the rash. And for those people, they could have the penicillin reintroduced and see whether they are truly allergic to it, or whether it was just the virus that they actually happened to have at the same time as whatever bacterial infection that the penicillin was treating. And then there is some studies to show that people who have had no exposure to penicillin for 10 to 15 years, they can try reintroducing penicillin, and maybe the allergy can actually have disappeared and they are okay with that. So somebody who is getting multiple infections, they're struggling to find an antibiotic to treat them, they may actually try a reintroduction of penicillin, even if they have had a true penicillin allergy at the first exposure. So that's all very interesting research, especially seeing as we are sort of getting more and more antibiotic resistant. Okay. Yeah, Laurie again. So it's just something to bear in mind, just in case you ever get told we may test you for penicillin allergy, to make sure. Just be open to that discussion. Yeah, as I mentioned, kiwi is one of the fruits that can have sort of a link to latex allergy. Yeah, it's always useful to have multiple lines. So as I was, oh, hello, hello to, is it Ali, your parents' cat? My cat's busy hiding. So, hi DC. Yeah, so yeah, so I was going to move on. So when it comes to treating allergies, so we've talked about sort of house dust mites, cats, dogs, hay fever, all of these. Quite often antihistamines are the first line, but then yes, steroids can be used second line. Now there's two ways to use steroids. For somebody who's having severe allergies, and maybe somebody who's got severe um, allergic dermatitis on their body, having severe asthma flare up because of allergies and things, they may actually have oral steroids and actually take it as sort of prednisolone tablets. And that can be really good for getting on top of reducing the inflammation and the, the allergies causing that histamine overload, that inflammation that's happening in the body, and getting on top of that. And it's great, and it can be used short term, hopefully, to get on to top of it. But obviously, if you end up using steroids long term, oral steroids long term, there can be problems. It can cause weight gain, especially around the middle and around the face, causing the steroid moon face, the water retention. And then obviously then there's severe long-term risks of long-term steroid use of things like your bone density and needing to ensure that you've got enough calcium and vitamin D and such like. I've got a video about calcium and vitamin D if you're interested in watching that. But one thing that can really help allergies, because we know the steroids are useful, but we don't always want the systemic effect. That's when having a sort of either a topical steroid, so actually putting a steroid on the skin, steroid creams, they can be extremely useful in dermatitis and eczema when it's a localized area, placing it on. If you're going to do this over the counter without the GP, then I do recommend it's short-term use, only sort of a week at a time, and not on the face unless you've actually discussed it with your GP, because they may want to use a different strength. And then there's also the hydrocortisone that you normally get over the counter, but then there are stronger steroid creams that can be given on prescription. And quite often dermatologists do use them, not just for sort of allergic dermatitis and eczema, but also for things like psoriasis as well, really reducing the inflammation. There is the long-term issue of using it on the skin too long can cause some thinning of the skin. So you really need to be looking at other options as well to reduce down. Just think, yeah. So Also, you only need to, when you are using topical steroids, you only need a very thin layer. It doesn't matter how thick the layer is that you apply on, only a certain amount will get absorbed into the skin and work. So you don't need to waste it. You only need to do a very, very thin layer. And then I would say leave it half an hour before you then put on any other creams. And then it's quite often useful to put a emollient barrier cream on your skin, because quite often if you've got any allergies on your skin, your skin barrier is breaking down. So actually putting a good sort of barrier cream on. For the majority of people, that just needs to be some sort of petroleum-based product, sort of oilatum. There's many different things, dipra-based, such like just the paraffin. Unless you happen to be allergic to paraffin, like my mum, and then you've got to hunt around and find something that's not paraffin based, but maybe coconut based, glycerol based, or such like. So that's steroids on the skin. For hay fever, steroids are very useful. It does take a while because it's helping reduce the inflammation. If you can get it started early into your symptoms, so as pollen's on the rise, or as you're going to be spending time with pets, the earlier you get it in, the easier it's going to act, and it can take 2 or 3 days for its action to fully develop. Short-term use, if you're buying it yourself, using it over the counter, because there can be irritation if you're using it long term, and that if you do need to use it long term, it's worth talking to your health professional about that. Personally, I would say the steroid nasal sprays are more effective than the antihistamine sprays. I would usually say take the antihistamine as a tablet, use the steroid nasal spray. If you do want anything else as a spray, it's probably something to actually just flush out the pollen. And then actually, when we talk about asthma, when there's an allergic component to asthma, and asthma is inflammation in your lungs, the steroid inhalers are the best thing for treating asthma. Getting rid of that inflammation, keeping them lungs, sort of reducing the irritation and the inflammation in the lungs by having that steroid. And I talk a lot about that in my video about sort of why asthma still kills. Steroid inhalers are really, really useful for it. And there has been a lot of people worrying about using steroid inhalers. You hardly get any systemic absorption into your bloodstream. It is all localized into your lungs. For those people who find if they're using the steroid inhaler, it causes thrush in their mouth, using a volumatic, which is what I always recommend, or a dry powder device, reduces that. And also making sure, because you need to use your preventer usually morning and night, twice a day. Make sure you time it to use it 10 minutes before you brush your teeth morning and night. That way you're going to be clearing out any deposits in your mouth. So hopefully that's covered steroids. There is also the steroid injections, but these are not available on the NHS because they have very limited data on using steroid injections. They used to try and use them at the start of the hay fever season to help people, but there's very limited evidence, so they don't do them on the NHS anymore. You'd have to pay private to go and get that. Yeah, they can be for certain tree pollens. Yeah, I was going to say, yeah, taking oral steroids can be very aggressive. No, it was developed for, so incrusiliptor has a um, long-acting antimuscarinic in it, which was first developed for COPD and is one of the mainstays in the treatment for COPD. So when you're treating COPD, it probably is one of the first-line agents that you use, whereas in asthma, one of the first-line agents that you use is steroid. However, they have found a subset of people with asthma actually get some benefit from the long-acting muscarinic in the incrusiliptar, and it is being used for some asthmatics as well. Just like the steroids, although they're not always useful in COPD because there isn't any sort of um, inflammation for them to get to. For a certain subset of people with COPD who have historically had asthma or allergies, they still benefit from having the steroid. So, yes, one set of inhalers were developed for asthma, one set were developed for COPD, but there is some crossover because the lungs don't necessarily always fall into one neat category or the other. A lot of us, we don't always just have one medical condition. We can be a mixture of medical conditions. Mhm. Yeah, yeah. So testing from an actual respiratory consultant or an allergist, it is best. I'm just going to say those ones that you buy online, be very, very wary of, especially when these ones that you're buying online often come with them also trying to sell you supplements. And we know that they're going to find something wrong with you so that they can sell you a product to go with it. Um, I can do one on vitamins. So I've done can you overdose on vitamin A and can you overdose on vitamin D and calcium. I have talked randomly in some previous live streams about random vitamins, things like vitamin B17 that doesn't exist, vitamin B6 you can overdose on, can cause some neuropathies, which I'm concerned about in a lot of supplements. They always seem to throw vitamin B6 in there just randomly, seem to stick it with magnesium for some reason. And I have also covered about the fact that vitamin C can cause kidney stones in high doses. So yeah, vitamin D deficiency. Yes, I have done a standalone video on can you overdose on vitamin D and calcium, but I do actually go into when you would actually take vitamin D, when deficiency does need treating, and when you might need vitamin D for, say, osteoporosis. Uh, yeah, so yeah, I've been going through the fat soluble ones first because obviously they are at higher risk of overdose than the other ones. COVID. Right. So this is common with opioids. What was it? Pink did the song "Your Morphine's Making Me Itch." I think that's what I tagged to my Insta post for this. You're just like a pill by Pink, and it says "Your morphine's making me itch." It's very very common for the opioids to actually cause skin hives and an itch, which is slightly an allergy, but sometimes people work through it because they need the pain relief. And so, yes, an antihistamine can help. So, people who are having sort of a hive reaction to medication and foods, if it's not a full on sort of getting towards an anaphylactic allergy, you can take your antihistamines. What I would say is, if so, like my mum, like when she accidentally drank some um, she drunk a punch that had strawberries floating in and she didn't realise. So she drank it and then she came out with hives all over her body because it had been exposed to strawberries. She could then take an antihistamine to get rid of those hives off the body, and that's fine. If you know that you've got an anaphylaxis um, reaction to a food and you're wondering, should I or shouldn't use my EpiPen? Don't go down the antihistamine route. The antihistamine route is very unlikely to be enough. And this does get put wrong in a lot of films and TV. They show people glugging down bottles of Benadryl and such like. And that is not going to work. If you're going to have an anaphylaxis, you're going to have an anaphylaxis. You must use your EpiPen. For those that have used an EpiPen, they are very, very simple. And if you actually come across somebody who is having an anaphylaxis and has an EpiPen on them, usually the instructions are in there and very, very clear. Anybody can give an anaphylaxis. You do not need to be medically trained, but if you want to, go and watch a YouTube video to sort of get that knowledge. anybody can give the life-saving EpiPen. It's blue to the sky, orange to the thigh. That's the usual thing. So one end is pointed to the sky, the other one usually is into somebody's thigh, and it's usually as you either press it or press a button, it will inject it. Usually, normally it's helping the person. The person knows how to give it. It's normally helping them get it out the packaging and holding their hand and letting them sort of show you how to do it while they're in their panic state. Or dial 999 or 911 and ask the person on the other end of the phone to talk you through giving the EpiPen. Sometimes people will have two EpiPens because one is not always enough, or if there's a big delay between getting that one EpiPen and getting to hospital, they can have what's a rebound. If that EpiPen's wearing off, they might need a second dose. That's why they're always encouraged to have two EpiPens on them. I do know that unfortunately there has been supply problems with EpiPens and stupid prices with EpiPens. And if I could sort out politics and sort out that, I would. But I would say that is something to always prioritise people having EpiPens. I think there's been calls for making sure that schools have EpiPens available. Places like aircraft have EpiPens available. I do think, like we're getting more and more places with defibs available. I do think it might be useful for maybe things like cafes to be able to have an EpiPen, just in case. Yeah, so well, like hives, yeah. Yeah, and I think that we are trying to train more healthcare professionals that when somebody says that they have an allergy, to actually document what the allergy was. So actually to fully record in the information of what actually happened. Was it anaphylaxis? Was it rash? Was it vomiting, diarrhea? Was it just made them feel funny and they didn't like it? Yeah, and that's it. Even sort of with the allergy to codeine, some people can't cope with codeine, and although codeine is changed in the body to morphine, they can tolerate morphine, or they could tolerate oxycodone or one of the others. Um, High temperature seems weird, although that can be a thing. It sort of sets off your thermoregulations. It's not as though it's caused you to have a infection. It's caused your thermoregulation to go off. And yeah, unfortunately, being as high as a kite on opioids is actually a side effect. And so that's just the benefit of is the more benefit of pain relief to you being high as a kite, which for somebody maybe laid in ICU, it might be of benefit. I know somebody who was on ICU and they were having total hallucinations while they were on morphine. But then once they left ICU, everything was fine. But it wouldn't be sensible for them to have that outside of ICU if they could then get in control of the car or such like. Right. Autoimmune and allergies, they are both thinking. They are both along the same, and there is a big crossover. And a lot of the newer biologicals that are being used to treat autoimmune conditions are now being used to treat allergies as well, because there is a big connection. It is both your immune system going haywire, either your immune system attacking a external product that's coming in and then causing your body side effects, or it's your immune system attacking its own body. And a lot of the more stronger treatments for allergies and autoimmune are sort of immunosuppressants. And then we've got these new biologicals that are coming on. Oh, sorry, I think thinking that was thing that you said penicillin. Penicillin makes you high as a kite. That is very strange, but I would definitely get that documented and be careful about that in the future. Um, so, but yes, there is a connection, and that is why there is now some new biologicals. So the biologicals are things that are called, they usually end in MAB, which is monoclonal antibody, the M and the AB, monoclonal antibody. And there's ones things like dupilumab and omalizumab, and a few others. And then there's a whole load that end in nib, baricitinib, and a few others. And they're being used for asthma with a very allergic component to them, and atopic dermatitis and atopic eczema when it's rashes, and allergies to different things in the food, probably multiple things in the diet that you just can't be excluding all of them all the time. And they have even got trials actually using them for people with severe anaphylaxis, having these monoclonal antibodies, not so that they can go out and eat the drugs that eat the foods that cause anaphylaxis, but that if they accidentally do eat the foods that cause the anaphylaxis, it may not result in death. It can be a much more lower threshold anaphylaxis reaction that responds much easier and quicker to the EpiPens. And so they are working really, really well. So, hi, Rob. Rob's a family friend that I've known for years. So, hi, Rob. Great to see you here. No. Small amounts, a small thin layer, it can be really good to get the steroid there early, use it on the skin, get it under control. The steroid is not going to be absorbed systemically unless you're using a really high strength for a long period of time on a large surface area. So, and they usually, if you're getting a very high strength, a very large surface area for a very long time, you would then be asked to sort of reduce down. But actually getting it under control using a steroid cream is much better than it getting that severe that you then need to actually take steroid tablets to get it under control. And atopic eczema quite often does get bad enough that you need to have actual steroid tablets to get it under control. So if you can get it under control using a steroid cream and not having to take it as tablet form, that is much better. However, one of the main things with the atopic eczema is the barrier of the skin is compromised. Things are getting through it, that actually inflames it, makes it worse. So having a good thick barrier cream a couple of times a day, 2 or 3 times a day, to keep that barrier is really worth it. And yeah, you need to do that alongside. There's no point just doing the steroids. You need to do the replace that barrier on the skin, avoiding quite often a lot of the barrier creams and emollients that you get given. They can actually be used as soap substitutes, because obviously a lot of soaps and shower gels and such like are actually harsh and irritant, especially when they've got fragrance in. So a lot of the actual emollients can be used as a soap substitute. They do actually have a bit of a surfactant in them to allow oil and the fat and the oil in there to mix with water. So they can be used as a soap substitute, and then after they've had a bath or a wash, layer it on before the skin dries out fully to keep that moisture and barrier there. Yeah, I love Dr. Mike. If anybody doesn't follow Dr. Mike on YouTube, he is great. He's very, very good at explaining things. He does some great reaction stuff. But yes, he had somebody having an anaphylaxis on a plane. They didn't actually have an EpiPen, so they just had a vial of adrenaline, and he had to work out getting that vial of adrenaline into the patient. But then he met up with the person, and that's a lovely video of when he actually met up with the person who he saved the life of. I think they were over the Atlantic, so there wasn't exactly anywhere that they could just land and go to the hospital of. So I've covered quite a lot. I've gone off on quite a few tangents. There is actually so much more to do with allergies. If you are watching me on Instagram, I do quite often share some of, I watch quite a few allergists on there. I follow a few gastroenterologists as well, with that being my specialist subject. And I do quite often share them in my stories. So if you see any of them, you might want to go and follow them as well. So I've had a really good time. I was wondering how exciting allergies was going to be, but I think it's something that affects everybody. Um, Whether you've just got a touch of hay fever to people that have got anaphylaxis, and it's always useful. Make sure that if somebody does have allergies, ask them about it and do take them seriously. I do think there's a bit too much of, yes, there are people that overuse allergies to get their own way, but when people do truly have anaphylaxis allergies, it is a life difference. And I know I've got a family friend, and a lot of people sort of mistake the fact that they've got a milk allergy that could actually kill them with oh, you're only a little bit of lactose intolerance, it'll just give you a bit of diarrhea. No, there's a big difference. The difference with sort of celiacs really do have to avoid gluten because the damage it can cause to the intestines is severe. It's not like, oh, it makes me feel a bit bloated. No, it's a different thing. So, and I think it's useful to know that. Oh, yeah, a lot of people do find La Roche-Posay. I've tended not to use La Roche-Posay, but that's because I've watched too many skincare influencers who say that because La Roche-Posay sell in China, they're not fully animal cruelty free. But a lot of people, the La Roche-Posay range are really, really good for people with eczema. Um, yeah, so yeah, yeah, washcloth is really good. You know, I don't know why flannels seem to go out of fashion, but yeah, just having what we call a stripped down wash where you do your pits and bits. You don't always have to have a bath or a shower every day. And actually, for some people with severe eczema, not having baths and actually allowing your body's own barrier and oils to actually be on your skin can actually be better. Which, I'm sure there are people out there that sort of go, yeah, that's any excuse not to have a bath. But yeah, sometimes I think for most babies now, they only recommend having a bath every other day and not every day. Although sometimes having a bath can be a very good routine for if you've got insomnia, just to relax. Or like I find, I love my bath because when my joints are hurting, to soak in a warm bath is the one thing that actually soothes my joints. So it's always the balance. Do I want my eczema to flare up or do I want to soothe my joints? Uh, yeah. Oh, yeah, I'll make sure that I respond to everybody. And if you've got questions in between and you've got ideas for future videos, let me know. I was debating whether I'd change these lives from every 3 weeks to every 2 weeks. Don't know whether DC's online, but I know I was on one of her lives the other day where we were debunking the craziest of claims from an MLM company, and I'm interested in maybe doing sort of that sort of line of streaming with one of those more experienced streamers where we actually look at some supplements, go through the ingredients and debunk whether they're actually needed or not, and whether you actually need to pay, $100 a month for that supplement, or whether we can find an equivalent in the local supermarket that will do exactly the same. So, but yeah, great to have you all here again. And yeah, I should have another video up this week. I've written it. I've just not had time. We're going on holiday to Iceland on fulvic acid, which is a breakdown product of plant matter that you find in soil, which is very interesting that people try selling mud. That's very interesting. Oh, yeah, I if anybody noticed, I got mixed up with being American. I thought that the UK was changing from GMT to BST this weekend, from GMT to British summertime, but no, it was actually just America that was changing. We change in I think it's in 3 weeks' time at Easter. We changed to British summertime, and then yes, I hate it moving forward. But so if anybody noticed that I put a post up and then dropped it and put a new post up with the change, yeah. Thanks for being on, Lisa. Yeah, and I'll see you all again soon. Excellent. Bye.